Hey guys, how are you? I hope you're well. Do I seem thrilled? Because I'm not. So, I called the doctor because myself and the doctor's office have been running back and forth trying to catch each other, and it wasn't working. We kept missing each other and missing each other and missing each other. So finally, I just decided, you know what? I'm just going to go ahead and call them and make the freaking appointment. It don't matter, you know, what time of day it is. I don't really care. Let's just let me call them. So when I called, apparently there were some notes in the computer. If they're usually people that are real good like that, they will leave notes. So when you call, the person that you call is not clueless as to you know, what's going on with you. So anyway, when I talked to her today to make the appointment for February, I want to say it's February 1st. February 1st, I have to have a cystoscopy. Okay. Basically, they take, I've seen it happen with a friend of mine. They allowed me because I was, involved with the medical field and all this. So they let me um, stay in on her procedure, and she was fine with me being there. She don't care. So they basically put some numbing stuff, if they do it the same way. They put some numbing stuff in your urethra, which is the tube. Some of y'all know this, some of y'all don't. It's the tube that carries urine from your bladder. That's the tube that the urine travels down so you can go to the bathroom. They put some stuff in there in the urethra. It's a little tube. They put numbing stuff in it, and then they give it plenty of time to numb. Plenty of time to numb. And then they put a cystoscope in there. It's like a little thing that has a long tube on it with a camera, and they slide that in the urethra. You're going to feel a lot of pressure, and you're going to feel it shouldn't hurt. You feel a lot of pressure, and it'll feel like you have to, like you have to go to the bathroom, you have to pee, but you won't have to. It's just pressure, from the cystoscope. So, because they want to see if this cyst has infiltrated into my bladder, and they want to, there's different grades of cysts. So the first grade, not a big deal. Almost everybody has them. They're harmless. They're not going to cause any problems. If you're talking about second, third, and fourth, then you're talking, especially if it has unusual markings in there, or it's uneven and it's just got some weird variations in the tissue, then it could be something serious, as in cancer. So that's why they put the cystoscope in there in the first place, so that they could see if there's been any type of infiltration, if there's anything inside there that is going to cause problems, or whatever the case may be. They won't know till they look in there. So, a cystoscopy is a procedure to look inside the bladder using a thin camera called a cystoscope. A cystoscope is inserted into the urethra, the tube that carries pee out of the body, and passed into the bladder to allow a doctor or nurse to see inside. So, since I'm a female, it's going to be a little bit easier because the tube is not as long as it is with a man, right? Because a man has obviously the penis, and it has to go through the entire penis inside the urethra, deeper inside to get to the bladder. We don't have that, right? So it's easier. It's a shorter trip into the bladder, if that makes sense. Okay. So I have to have that. Let's see. Hold on. That's not what I wanted. Okay, so 1, 2, 3, 4. All right, so I'm trying to figure out why you're not letting me get access to that. All right, hold on a minute. I'm going to try to give you more information about cysts. All right, that's getting way too deep. Okay. Okay. So, as you guys know, I have a cyst in my pelvis. We haven't even addressed that yet. We're just addressing the cyst in on my kidney, okay? And this is from the radiopedia.org. Radiopedia.org. The Bosniak classification system of renal cystic masses divides renal cystic masses into 5 categories based on imaging characteristics on contrast enhanced CT. It helps predict a risk of malignancy and suggests either follow-up or treatment. Okay, so the official Bosniak classification uses Roman numerals, not Arabic ones, for each category. The use of the term grade, stage, group, and type or similar for each, maybe they meant to put are similar for each category, is technically incorrect. The 2019 version has switched from category to class. Okay. Okay. So there's Bosniak 1, which is a simple cyst. Hairline thin wall, water density, no septa, calcifications or solid components, no enhancement, workup none, percentage malignant 0. Benign cyst 2, minimally complex. Few hairlines thin, perceived enhancement, non-enhancing, high attenuation due to proteinaceous or hemorrhagic contents, generally well marginated, workup none, percentage malignant 0 to 6%. Okay. Bosniak 3, minimally complex, multiple hairline thin septa or minimally smooth thickened walls or septa perceived, but no measurable enhancement of wall or septa. Calcification can be present and may be thick or nodular, generally well marginated, high attenuation lesion, 3 centimeters diameter, totally intrarenal, 25% of the wall visible, no enhancement. Requires follow-up, needs ultrasound, CT, MRI follow-up, either any of those. No strict rules on the time frame, but reasonable at 6 months, 12 months, and then annually for 5 years. Percentage malignant, 5 to 26%. Okay, so that's 1, 2, 3. Okay, Bosniak. Was that 2? I don't know what these numbers are. Anyway, I can't. Yeah. Anyway, the next higher up. Intermediate cystic mass, thickened, irregular, or smooth walls or septa with measurable enhancement, treatment, workup, partial nephrectomy, or radiofrequency ablation in poor surgical candidates. Percentage malignant, 55 to 72%. I would think that would be 3, but no, it's not. Is it 1, 2, 3? You would think that's 4, but it says 3, so I'm a little confused. Okay, so the next one higher than that, because we're not going to go over the numbers. I don't really give a shit. Clearly malignant cystic mass, Bosniak 3 criteria, and enhancing soft tissue components adjacent to but independent of wall or septum. Treatment, partial or total nephrectomy, which means they would take the kidney out. Percentage malignant, 91 to 100%. Okay. Oh, it's making me tired. So this was named, the Bosniak classification is named after Morton A. Bosniak, who was a professor emeritus in radiology at New York University, Langone School of Medicine. It was first published in 1986, introducing the 2F category in 1993 and revisions in 1997, 2005, and 2019. Okay? So the more the cyst has going on, the more it's, it increases the chance of it being malignant, which is so. For those who don't know, I'm not trying to insult anybody's intelligence, but some people really don't know. Benign means non-cancerous, and malignant means cancerous. And again, they won't know till they get in there. Hold on. No, and this was my biggest concern. Although I know it's not terrible. I witnessed my friend getting one, and she wasn't like gripping the table or screaming or crying or anything like that. So it's in our minds, our imagination takes it all the way to the crazy page. And then when you get it done, you're like, holy crap, I survived that. It wasn't as bad as I thought. And I hope to God that's the way it is. But anyway, how painful is cystoscopy procedure? People often worry that a cystoscopy will be painful, but it does not usually hurt. Tell your doctor or nurse if you feel any pain during it. It can be a bit uncomfortable, and you may feel like you need to pee during the procedure, but this will only last a few minutes. Okay, so why would a urologist order a cystoscopy? During a cystoscopy, a urinary tract specialist, urologist, uses a scope to view the inside of the bladder and urethra. Doctors use cystoscopy to diagnose and treat urinary tract problems. These problems include bladder cancer, bladder control issues, enlarged prostates, and urinary tract infections. Obviously, women do not have prostates. Okay. Anesthesia or IV sedation is given and a numbing jelly is then applied to your urethra. After waiting a few minutes, the cystoscope is then gently advanced through your urethra. So they can give you sedation, which is nice. You'll be awake, but if they sedate you, it'll just calm you down. You'll be aware of what's going on, but you won't care. So I don't know. I've never had this done. I've just witnessed somebody I know have it done. I've never had it done myself. So a cystoscopy is a thin, about the width of a pencil, bendy cystoscope, and you stay awake while it's carried out. Rigid cystoscopy, a slightly wider cystoscope that does not bend, is used, and you're either put to sleep or the lower half of your body is numbed while it's carried out. So it depends on the type of cystoscopy they do. Okay. Do you get the results right away? You get the results 1 to 2 weeks after your follow-up appointment. Okay, let me see. So I'm going to see if I can get an image of a cystoscope for those of you who are interested. Oh my. So here is, and I don't know how well you guys are going to see this, but here is the cystoscope. See that? And then you got the long tube that goes, it's a flexible tube that goes in through the urethra into the bladder. This is the inside of the bladder. Don't know what that is, but it doesn't look good. What is the recovery time? Rest at home for a day or two. You may need to take a couple days off work if you work. Make sure someone stays with you for the first 24 hours. Do not drive or drink alcohol for at least 24 hours. Okay. Okay, so anyway, that's what's going on there. My friend has to have a procedure as well. And I said, do we always have to compete with each other? We're not competing. I'm being funny, but not really, because like he had to have surgery and then I had to have surgery and then I had this going on. Then he had something going on. Now he's got something going on and I've got something going on and he has to have a procedure and I have to have a procedure. And it's like, can we not compete? Because it feels like a competition and I would love to lose. I would love to freaking lose. I would love it. Love it. Please, I want to be considered a loser when it comes to things like that. Let's see, maybe I'll go up a little bit more. Okay, anyway. So one thing, and we've talked about this before, but we'll talk about it again because we got nothing to lose. So far as toxic people go, if you do not know terminology, okay, you don't know what bipolar is, or you don't know what narcissism is, or malignant narcissist. You don't know any of the verbiage at all right? Have no fear. Have no fear. One of the ways that a toxic person reveals that they're toxic, the verbiage doesn't really matter, it's kind of irrelevant. They are constantly, or at least almost constantly, disagreeable. That is a red flag the size of the world. Disagreeable, argumentative, saying no because they freaking feel like saying no. Just disagreeable. Love it. They just love to tell you no. Love it. Love to forget your birthday, forget the holidays. They love to inflict emotional pain. I think that gets them sexually excited or something because they all do it. They all have to fight. They all have to argue. They all have to be disagreeable. And there's a spectrum. So some are going to be a lot more disagreeable than others. Telling you no just because. Can we go to the Rib Shack? I think there's a restaurant in Warrensburg called the Rib Shack. I think. Anyway, can we go to the Rib Shack? No. Why not? They're having a sale right now. They're having a promotion. No. Why not? I don't feel like it. Why are you asking me? Why are you questioning me? Why you got to question me all the time? You're trying to start an argument, aren't you? Now, mind you, they told you no, and they're going to accuse you of trying to start an argument because they're fucking assholes. Let's just keep it real. They're assholes. And because they have brain damage discovered by doctors, scientists, all types of brain experts, okay? They have extensive brain damage. Because they have extensive brain damage, their behavior is never going to get better unless they go to comprehensive therapy like Lee. Most narcissists will never, ever, 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 ever go to any type of psychotherapy. They're not going to do it. Their ego does not permit them to do it. Their denial of their behavior will not permit them to do it. They're just not going to do it. And because they don't want to face the fear, the shame monster, they have to desperately attack the other person. You started an argument. You're the one who did this. And you, and you, and you, and you, and you, and you. You know what? I think you're cheating on me. That's what I think. I think you're cheating. A lot of them will accuse you of cheating because they're the biggest whore around, except they're not getting paid for it. That's worse than being a whore. You're not even getting paid for it. You're just banging everybody because you ain't got nothing better to do with yourself. A lot of them are promiscuous. But anyway, I digress. So they're very disagreeable. Now, on the flip side of that, healthy people want to make you happy. If you're in a dual healthy relationship, meaning both of you are healthy, you want to make each other happy. You do not want to ruin the day by arguing. You do the opposite of a narc. Total opposite. Total opposite. And when your partner's upset, you don't get a boner because of it or get sexually excited if you're a woman. You don't do that. If you're healthy, you're like, babe, what's wrong? Nothing. Well, something's wrong because I could see it in your face and I could tell in your tone. What's wrong? Nothing. Okay. I'm not going to invade your privacy or anything like that, but I'm here for you. Whatever it is that you're going through, I'm here for you. You will never hear those words come out of a narcissist's mouth because they don't want you to have a better day and they're not concerned with what you're going through. They're only concerned with what they are going through. Okay? And a lot of their hell is self-inflicted. Just keeping it real. Whatever they go through is self-inflicted. And they love to go through hell. It's just, I think on some level they sabotage everything good because they don't think that they deserve anything better than what they're getting. So they're more than happy to, I don't know, destroy their whole life, destroy their relationships, destroy their marriages. They're more than happy to do that because on some level, well, they can't think straight because of their brain, number one. Okay. Number two, I think that they don't feel like they deserve anything better than that. So they continue to do jacked up things, which guarantee people will run away from you or from them, narcissists. Very argumentative. So that's a big red flag. Now, this is how it normally works, but there's different variations and there's different degrees of narcissism. So this could vary depending on the person you're dealing with. If they are disagreeable, okay, first of all, no, let me backtrack. Let me change that even more. They're gonna be agreeable in the beginning, usually, depending on the degree of narcissism. Some will be an ass right out the gate, especially an overt narc will be an ass right out the gate. They're not even gonna try to hide it. Covert is more dangerous because they try to pretend that they're a nice person. They wear the fake nice person costume and they give it enough time for you to catch feelings for them or until they think you have feelings for them. And then the mask slips off and the real them pops out. We talked about that many times. It could be 2 days, 2 weeks, 6 months, a year, 3 months, 4 months. There's different variations of when the fake nice person disappears and the real asshole comes out. They're never going to change for the better. They do change. They change for the worse as time goes on. And like Lee said, the more you forgive them, the worse they get. Because you keep forgiving. So now you're giving me permission to be more and more and more and more and more ignorant and to cheat on you some more because you keep forgiving me for cheating. So I'm going to keep doing it. Okay? I'm going to keep doing it. So take your sweet time when you're dealing with these people. But like I said, the red flag is like humongous. The red flag is massively gigantic with that disagreeable. They're going to be so nice in the beginning, usually. Oh, they're going to be so nice and so considerate and so sweet. And it's all a load of bullshit. Do not fall in love with these snakes. Take your time getting feelings for them. And for those of you who think you still love them, chances are you don't. You love the fake person that they pretended to be, but that person doesn't exist. That person doesn't exist. They're fake. Okay? They're fake. So if you still think that you have feelings for them, chances are you are trauma bonded. You are trauma bonded to them, but you think you love them and you don't. because normal people do not love to be abused and have fights all the time, and everything you do is a problem. The way you breathe is a problem. The way you hold your fork is a problem. The way you put your underwears on is a problem. Why do you put your right leg in your underwears first instead of your left? What is wrong with you? I am not kidding. They will take a microscope and start searching. Actually, this is a microscope, right? Start searching for problems, searching, hunting. Aha! I found something, instant satisfaction on their part when they are ruining people's lives. Instant satisfaction. Yay, I found something to argue with you about. Yes. This is why I am very happy that I do not have children. I am very happy. Number one, I don't need to be connected to a loser through a child. Number one. Number two, if I did everything I could to raise them properly and they turned into that thing, oh, I don't know if I could ever forgive myself. What the hell did I do wrong? And the scary part too, another part that's scary, even scarier. Narcissists are made, psychopaths are born. Let me say that again. Narcissists are made and psychopaths are born. So imagine you have a child and you did all the right things and they're a psychopath. Because they were born that way. Now, that'll be horrible. Narcissism, they're created, experts believe that they're created because of their environment, abuse, neglect, overindulgence, kissing their ass ever since they're little. They just developed this grandiose, super selfish lifestyle. Now, here's the thing. Here's the difference between a normal child and a not normal child, okay? A normal child has, I don't want to use the word selfish because that's kind of harsh. But they're self-absorbed because that's the nature of a child. However, once a child reaches a certain age, and I can't remember the age, I want to say it's 5, but I'm not sure. There's a certain age where they realize that there's a world outside of themselves. Like, okay, well, hold on. I'm curious about the age now. Darn it. Okay, I was close. I was thinking 5. I said where they developed the idea that I'm not the only person in the world and my needs are not the only needs in the world. All kids do that. I need, I. However, around 4 years old is when they can understand and show, normal children, not narcissists, okay? Around 4 years old, they can understand and show empathy for another person's perspective and their reactions to an event. Okay? Three-year-olds can even do it. 3-year-olds are starting to understand that other people have thoughts, feelings, likes, and dislikes that are different than their own. Now, the difference between a normal child and a not normal child, like a sick narc, is they never develop that. They never develop that, oh, wait a minute. Somebody else, mommy has needs? Oh. They never make that split into, I don't want to say split, but they never make that transition. There we go. They don't make that transition. Oh, mommy has needs, or oh, daddy has needs, or my sister has needs, or my sister is crying, she's sad. Oh, and then you try to comfort her or whatever. Narcs don't ever develop that. Never. It's always them, always all about them, and that's it, and it's about them. That's it. And they have, Lee says they have little empathy, little to no empathy. All the ones that I know have almost no empathy. The last snake that I knew, Henderson, um, zero, zero empathy. Zero. None. 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 I told y'all he could drive through an accident where there's blood all over the road and he'd be thinking, I hope I don't get that nasty blood on my tires because then I have to spend money to wash my tires off. Mind you, there's people in the road that are dead. He wouldn't give two fucks about that. He wouldn't care about that. It's all about him, baby. Okay. Anyway, and I told you guys before that there's a guy. This is crazy. I'm trying to tell you something. He works in a crime lab. Okay. And they all had tests done on their brain just for curiosity. What's going on with your brain? Are you normal? Are you abnormal? What's going on? One of the guys who works in the crime lab, when they tested his brain, he's got the brain of a psychopath. He's got the brain of a psychopath. Now, he's not a killer. He doesn't attack people, sexually assault them or anything like that. Okay. He just works in a lab and like every other person, but he has the brain of a psychopath. That is, oh, yikes. So I've seen computerized imagery of a normal brain and an abnormal brain. So like I said, there's proof that there's something wrong with the brain with these studies, these scans and whatnot. So there's different computerized color patterns depending on what is going on with that person's brain. So there's scientific proof. They could sit here and say, they don't know what in the hell they're talking about, and they don't want to admit that they're permanently jacked up. They don't want to admit that. But they know something is not right with them. Hold on, guys. I'm going to try to show you. And for those of you who are interested, I did a video on, oh, darn it. You're not doing it in color. Really? Why wouldn't you do it in color? Are you serious right now? Okay, here we go. Oh my. Anyway, I did a video on what's wrong with the narcissist brain. And I don't give a two shits what they think or disagree with or don't agree with. You're not a neurologist, you're not a scientist, and you're not a doctor. Shut the fuck up. Narcissists are going to argue because they're just not normal. So they're not going to agree with the fact that they are totally fucked up. They're not going to agree with that. But again, they're not neurologists. They haven't researched the studies or anything like that. So I don't really care what they say. This is, and the thumbnail of, I'll try to remember to put it in the description, but it's called, This is What's Wrong with the Narcissist Brain or something, the video that I did. It has a ton of views, so apparently people are into that. This here are scans, brain scans. Okay, this is proof that there's scans of the brain that shows normal and abnormal. This is not psychopathy or anything like that, but this is a depressed brain, a person who has depression. Darn you. Darn you. Okay. This is a depressed brain, and that's a non-depressed brain. See the difference? And that's just a tiny proof that the brain reflects when there's abnormalities. Let's see, what is that? Major task. Test trials. Ooh, yikes. There's even different, it gets complicated as hell. It really does. But they even show, I don't see it, but I read it just now. Neuroimaging alterations of the suicidal brain. Person who wants to eliminate themselves. There's patterns in the brain that are changed. So the body tells the story. Or there's isn't there a book called, and I've heard professional people say this, the body keeps score. It does. That's why you cannot stay in a toxic relationship. Your body will shut down. Your body will break, fall apart. You'll have so many medical problems, a ton of medical problems. And your body keeps score of all the trauma. You can't stay in that. You can't. You just can't do it. They're not worth it. All right. Now, for people who are in medical school, obviously they will know what each part of the brain is and this and that, and da da da. There's even, that's fascinating. I did not know that. Wow. What the hell? Imaging suicidal thoughts and behavior. You can see that on a brain. I didn't freaking know that. I'm a geek, so I study crap like that. Anyway, there's even um, extreme stress that will cause something called hold on, broken heart syndrome, and you can actually see like tremendous stress. For example, a woman, what is going on with you? Why are you doing that? Why are you doing that? I gotta charge it up. It's acting silly. Um, Sorry about that. Anyway, broken heart syndrome is severe stress, and it will cause, you don't have any other cardiac issues, but scans of the heart will show that it's under duress, and it will show abnormalities in the heart because you're under severe stress. So the body keeps score. It really does. Okay? So here's what it's called. We're learning all kinds of cool things today. Takotsubo cardiomyopathy or broken heart syndrome is when the heart muscle becomes suddenly stunned or weakened. Mind you, you don't have a history of heart problems, and you're not having heart problems that are cardiac related. It's stress related. Okay? It mostly occurs following severe emotional or physical stress. The condition is temporary, and most people recover within 2 months. So they can actually do scans of the heart during severe stress and see takotsubo cardiomyopathy. Symptoms of broken heart syndrome can mimic symptoms of a heart attack, including chest pain, shortness of breath, diaphoresis, which is excessive sweating, and dizziness. Okay? So, yeah, the body keeps score. It really does. So, for those of you who are going to school for medical, if you look up, wow. If you look up broken heart syndrome, you will see the scans and you will understand the scans. I don't know which is normal and which isn't. I'm assuming it doesn't say. Anyway, I'm assuming that's normal and this is abnormal, I guess. I really don't know. I'm not into that, but one of them is normal and one of them is a result of extreme stress, and it's called broken heart syndrome, or um, the other term, takotsubo cardiomyopathy. The body keeps score. It does. It really does. So free yourself. If you're stuck in a hellhole with a hellish person, free yourself, honey. Get the hell up out of there so you can reclaim your life and Get your health back on track. And I'm losing good lighting. I'm sorry. I had a snowball fight with my dog, and that was fun. And he eventually got mad and started biting my boots. I don't care. He'll get over it. Anyway, another snowstorm is coming. It's been snowing for like 2 days now. Another storm's coming Friday. Ooh, color me excited. Not really. Anyway, you guys take care. Much love, and stay narc free. Please stay narc free. Your body does not need that crap. Let them go fight and argue with somebody else. Let them look in the mirror and argue with their ugly ass reflection. Much love. Y'all take care. Bye.